Yeah, it's a great question. So we made sure that we use clear, plain language throughout the tool to really ensure that it was clearly understood by the user. We have very explicit guidance on next steps. So the call to action always is to talk to your primary care provider, talk to your screening program. We made sure to really balance the presentation of risks and benefits. So a high score, for example, does not necessarily mean you have disease, and a low score does not mean that you're at no risk. And so we really tried to frame that appropriately. We also tried to design it to support shared decision making. It's not a standalone tool, it's a supplemental tool. It's one of many that patients and clinicians can use to understand risk. And then we also baked in warnings and language about the warnings against self-interpretation. So this is not meant to be an official risk assessment score, only that can be done by the screening program. Well, one of the things we're hoping to see from it is more primary care providers thinking about lung cancer screening. So when a patient presents in their clinic that has the signs and symptoms of lung cancer, that they are thinking to make that referral for lung cancer screening. We're also hoping that it reduces stigma. And so, stigma is often a significant barrier for people accessing care. And so we're hoping that if they can do this in the privacy of their homes and whatnot, that it may help reduce some of that stigma. Yeah, so first off, lung cancer screening is not diagnosing. So it's just meant to be, to indicate that there may be something abnormal happening. But, lung cancer screening, any screening is not a diagnosis. Diagnostic assessment is needed. But a risk score is the same scenario. Just because you have a high risk score does not mean you have lung cancer. And so it's really important for clinicians to acknowledge that. And it's also really important for folks to understand just because they have a low risk score does not mean that there's no risk. And so we always try and encourage people to ensure that they're taking they're being proactive with their lung health. So, even if somebody comes in with a low risk score, we do hope that clinicians still talk about the importance of smoking cessation, smoking prevention, and other vaccinations, et cetera, to help the patient protect their lung health. Yeah, it's a really great question. So the risk calculator is based on the best available evidence. So right now, as an example, the risk profile is only for heavy smokers. What we're seeing globally is that there's an increase in cases among non-smokers. And so as the evidence base grows and as we understand what's causing lung cancer in non-smokers, the risk calculators such as the PLCO M2012 need to be updated to reflect the evidence base. And so once the PLCO M2012 is expanded in its comprehension of what is actually causing risk for lung cancer, then screening programs would need to follow suit. So these types of clinically validated tools really need to reflect the best available evidence, which will then influence organized lung cancer screening. Canada really is the one of the leaders in the world when it comes to lung cancer screening. We've implemented one of the first provincial pilots in the world, and the PLCOM 2012 model really stems from Canada, from Brock University. So we are quite proud of that. But this is one of the first repackaging of a very cumbersome tool into something that's user-friendly. And so we would encourage folks to definitely check it out on lunghealth.ca, where you can find more information about the risk calculator. It really is meant for anyone who's interested in understanding their risk profile.